What happens to your body if you walk every day? Walking is the best medicine, said the ancient Greek physician Hippocrates. It has been shown that constant walking for 15 to 30 minutes a day can change your appearance and make you healthier. Prevent heart disease. According to the American Heart Association, walking is as effective as running in preventing heart disease and stroke. This activity helps prevent heart disease by lowering blood pressure and cholesterol and improving circulation. Calm down. If walking can improve the depressive symptoms of a patient with this condition, imagine how much benefit walking would provide if the person were simply unhappy or mentally exhausted. You can certainly improve your bad mood. Positive changes in the brain. Studies show that walking can help prevent dementia, reduce the risk of Alzheimer's disease, and improve mental health. It also reduces mental stress and keeps endorphin levels high in the body. Improve eyesight. This may sound strange considering the eyes don't seem to make contact with the feet. But walking is also good for your eyes. Because it can help fight glaucoma, a condition in which fluid builds up in front of the eyes and increases pressure on the optic nerve. Increase lung capacity. Walking is an aerobic exercise that helps your lungs work, in addition to increasing the amount of oxygen in your bloodstream and removing other toxins that need to be eliminated. You can overcome it. Increase muscle strength. Just as you can lose weight, you can also increase muscle strength. Walking 10,000 steps every day is like working out at the gym. This is especially true for those walking uphill. Also, you are less likely to get hurt. Beneficial effects on the pancreas. Studies show that walking has a better effect on the pancreas than running. According to the study, the group who walked for 6 months showed 6 times more glucose tolerance than the group who ran. Prevent diabetes. Getting used to walking at about 4 miles per hour and driving for about 50 minutes can delay or prevent the onset of type 2 diabetes, especially in obese people, National Institute of Diabetes and Dental and Kidney Diseases. As we know, diabetes cases that can be overcome without the need for medication can be resolved with regular exercise. Is not required. This means that brisk walking is as beneficial as anti-diabetic drugs. Reduces risk of stroke. The benefits of brisk walking for stroke have never been as real as for heart attacks, but some studies show promising results. Look at the natural evidence that our ancestors engaged in more walking activity each day. In the past there weren't as many cases of stroke as there are today. 70,000 nurses working 20 hours a week. Harvard University School of Public Health found that the risk of stroke was reduced by 2/3. Reduces risk of heart attack. We know that the heart muscle needs more blood, from the coronary vessels that nourish it, in order to be healthy and functioning properly and pumping blood without stopping. For this, the myocardium requires a stronger and more uniform blood flow. A brisk walk increases blood flow to the coronary arteries. Thus, the myocardium is covered with sufficient oxygen to keep the heart muscle beating well. Not only that, but the flexibility of the body's arteries, which had been trained to contract and dilate, is aided by spasms of the body's muscles around the vessel walls when engaging in fast walking activities. As a result, blood pressure tends to decrease, and the adhesion between blood cells, which causes blood clots that clog blood vessels, is also reduced. In addition, good cholesterol, HDL, which absorbs bad cholesterol, LDL, like a sponge, increases with brisk walking. Other than exercise, there aren't many non-medical ways to raise HDL levels. A brisk walk can cut your heart attack risk in half. It turns out that as you get used to walking regularly, your body's metabolic rate increases. In addition to the amount of calories wasted by the walking activity, any extra calories that may be present are burned by the body's increased metabolism, so no weight gain occurs. In addition to maintaining a stable weight, those who start gaining weight can reduce it by doing these brisk walking activities regularly. Burned by walking for at least 1 hour. Strengthen joints and bones. Regular walking can increase joint mobility, prevent bone loss, and even reduce the risk of fractures. A moderate daily walk of at least 10 minutes is recommended. Improve digestion. Walking for 30 minutes a day not only reduces the risk of future colon cancer, but it also improves digestion. Colon cancer is also caused by feces that stay in the digestive tract for a long time. Another study also mentions the role of walking in potentially reducing the risk of breast cancer. Get rid of back pain. Walking can be a savior for those who experience back pain during more strenuous exercise. Walking increases blood flow to spinal structures, improving posture and flexibility, which are important for spinal health. To do. Prevents osteoporosis. Exercise and brisk walking not only strengthen the muscles of the body, but also strengthen the bones. Calcium metabolism requires not only morning sun but also physical activity. Calcium and vitamin D alone are not sufficient to prevent or slow the progression of osteoporosis. To be free from the threat of osteoporosis, the body also needs exercise and at least 15 minutes of sunlight in the morning. It's estimated that people who exercise from a young age and get enough calcium by the age of 70 aren't at risk for bone loss.